London, United Kingdom, January the 7th. On January the 7th, large parts of the United Kingdom woke up to a country frozen in place by one of the most severe snow and ice events of the winter so far. A prolonged Arctic cold spell had settled over the British Isles days earlier, but overnight snowfall combined with sub-zero temperatures pushed already fragile conditions past a critical threshold. By dawn, roads, rail lines, airports, schools, and public services across England, Scotland, Wales, and Northern Ireland were severely disrupted. According to confirmed observations from Met Office, snowfall intensified during the night of January the 6th into the morning of January the 7th, particularly across Scotland, northern England, parts of Wales, and higher elevations further south. In Scotland, the heaviest accumulations were recorded, with verified measurements exceeding 40 centimeters in several upland areas, and a maximum accumulation of approximately 52 centimeters reported at a monitored site in the northeast. Snowdrifts driven by persistent northerly winds rendered many rural roads completely impassable. Northern England experienced widespread snowfall ranging from 10 to 25 centimeters, with higher totals across North Yorkshire, County Durham, Northumberland, and the Pennines. In the Midlands, snowfall amounts were lower but still disruptive, generally between 5 and 15 centimeters, falling onto already frozen surfaces. Wales saw significant accumulations in Powys, Gwynedd, and mountainous regions, where snowfall exceeded 20 centimeters and visibility dropped sharply. London and much of southern England saw lighter snowfall in terms of depth, typically between 2 and 8 centimeters, but the impact was amplified by severe ice formation. Freezing temperatures caused snow to compact rapidly into hard ice, creating extremely hazardous conditions on untreated roads and pavements. Overnight minimum temperatures fell well below seasonal norms, with some locations in eastern England and rural northern areas recording values near or below -10 degrees Celsius. Even in London, temperatures remained below freezing for extended periods, preventing any meaningful thaw. The consequences were immediate. By the morning of January the 7th, at least 775 schools across the United Kingdom were confirmed closed due to snow and ice. Wales reported more than 350 closures, Scotland over 300, Northern Ireland around 200, and England more than 100. Many schools cited unsafe travel conditions for staff and students, frozen buildings, and impassable access roads. Transport networks struggled to cope. Road authorities reported hundreds of weather-related collisions nationwide, most involving vehicles skidding on ice or becoming stranded in snowdrifts. Several major routes in northern England and Scotland were temporarily closed, while secondary and rural roads remained blocked throughout the day. Emergency services responded to a high volume of incidents, including motorists trapped in vehicles and pedestrians injured in falls. Rail services were heavily affected. Snow accumulation on tracks and frozen, switching systems caused widespread delays and cancellations, particularly across northern England and Scotland. Several lines were completely suspended for parts of the day as crews worked to clear snow and restore safe operations. Commuters in major cities faced significant disruption, with overcrowded platforms and reduced services. Air travel was also impacted. Liverpool John Lennon Airport temporarily closed its runway for snow and ice clearance, resulting in more than 30 cancelled arrivals and departures before operations gradually resumed later in the day. City of Derry Airport announced a full closure due to runway conditions, stranding passengers and disrupting regional connections, while London airports remained operational. Delays and cancellations affected schedules throughout the day as aircraft de-icing operations slowed turnaround times. International knock-on effects were observed as well. Persistent winter weather across northern Europe contributed to widespread flight cancellations at Amsterdam's main airport, affecting hundreds of services and disrupting travel plans for passengers connecting through the UK. Cross-border rail services linking London with mainland Europe were reduced, with some trains cancelled or terminating early due to conditions beyond the UK. Healthcare systems faced mounting pressure. UK Health Security Agency maintained amber cold health alerts for England on January the 7th, warning of increased risks to vulnerable populations. Hospitals reported a rise in admissions related to
L to
falls on
minus
ice,
8C,
hypothermia,
18F.
and cold-related complications, particularly among the elderly and those with pre-existing conditions. Social care services activated emergency protocols to support isolated individuals and ensure continuity of care. Power disruptions were reported in several regions as ice accumulation and snow-laden branches affected local distribution networks. Utility crews worked throughout the day to restore supplies, with most outages resolved within hours, though some rural areas experienced longer delays. As the day progressed, the scale of the disruption became increasingly apparent. Urban centers slowed to a crawl, while rural communities faced near total isolation. Snowplows struggled to keep pace with drifting snow, and grid supplies were stretched as freezing conditions persisted, even where snow had been cleared. Refreezing turned wet surfaces into sheets of ice by nightfall. Beyond the confirmed statistics and official statements, the human experience of January the 7th revealed the true impact of the event. Streets fell eerily quiet as traffic disappeared beneath snow and ice. Abandoned vehicles lined roads, some left at awkward angles after losing control. People moved cautiously, gripping railings and walls to avoid slipping. In many neighborhoods, residents banded together, sharing shovels, clearing paths, and checking on vulnerable neighbors. For commuters, the day became an exercise in endurance and uncertainty. Journeys that normally took minutes stretched into hours or were abandoned entirely. Parents scrambled to arrange childcare as schools closed with little notice. Workers slept at offices, hospitals, and transport hubs, unable to travel home safely. The cold itself was relentless. A biting northerly wind drove temperatures even lower, making conditions feel harsher than the thermometer suggested. Snow that initially seemed light and manageable hardened into ice, transforming minor accumulations into major hazards. Each step became a calculated risk, each journey a challenge. By the evening of January the 7th, exhaustion had set in across the country. Emergency services continued to respond to calls. Councils worked through the night to clear priority routes, and weather forecasters warned that freezing conditions would persist into the following days. While snowfall intensity eased in some areas, the legacy of the event remained locked in ice. January the 7th did not bring record-breaking snow everywhere, but it delivered a potent combination of cold, snow, and ice that exposed vulnerabilities in daily life across the United Kingdom. It was a day defined not by a named storm, but by the quiet, grinding power of winter itself, an event that froze a nation in place, tested resilience, and left millions with a lasting memory of how quickly normal life can be brought to a halt by snow and cold alone. By mid-morning, local authorities reported a sharp increase in road traffic accidents, particularly on untreated rural roads and secondary routes. Police forces across England, Wales, and Scotland confirmed hundreds of weather-related incidents, ranging from vehicles sliding into ditches to multi-car collisions on major arteries. In several counties, sections of motorways were temporarily closed after jackknife-ed lorries blocked lanes, causing tailback stretching for miles. Recovery vehicles struggled to reach stranded motorists as snowdrifts and compacted ice made access difficult, especially in exposed areas and higher elevations. Rail travel remained severely disrupted throughout the day. Heavy snowfall overnight had frozen points and coated overhead lines, leading to cascading delays during the morning commute. Even where tracks were technically passable, reduced speeds were enforced for safety reasons, significantly extending journey times. Passengers reported being stranded on stationary trains for hours as crews waited for clearance to proceed or for replacement services to be arranged. Rail operators issued repeated warnings urging people to travel only if absolutely necessary, acknowledging that conditions were unlikely to improve before nightfall. Airports faced similar challenges. Despite continuous snow clearance operations, repeated bursts of snowfall forced temporary runway closures at several regional airports. De-icing procedures slowed departures, and crews worked against the clock to prevent ice buildup on aircraft surfaces. Hundreds of flights were delayed or canceled, leaving passengers sleeping on terminal floors or queuing for hours to rebook. For many, onward connections were missed, compounding the disruption far beyond the UK's borders. Schools across the country remained closed, not only because of hazardous travel conditions, but also due to frozen pipes, heating failures, and staff shortages. In rural communities, school transport services were suspended entirely after buses were unable to navigate snow-covered roads. Parents scrambled to make alternative childcare arrangements, while local councils activated emergency plans to support vulnerable families affected by the closures. Hospitals and healthcare services operated under intense pressure. Ambulance response times increased in several regions as crews navigated icy streets and dealt with a surge in fall-related injuries. Emergency departments reported higher than usual admissions for fractures,